Hi there, everybody. Dr. Sunil Dand, internal medicine doctor with Common Sense COVID Doctor. Let's talk about loss of taste and smell in COVID and treating these patients with a short course of steroids. If we go back to the beginning of the pandemic, January, February, March, we know that a lot of patients at that time were presenting with this unusual symptom. They were saying, oh, I can't smell correctly, my taste sensation has gone. And this wasn't something that we were seeing with a lot of other viral infections, including influenza. It was very specific to COVID infection. Millions of patients were reporting this particular symptom. If we think about hospitalized patients, I know I was there at the front line, January, February, March. We weren't really sure how we should be treating COVID any differently from other severe viral pneumonias. Then as time passed, more and more data was coming out. We had the recovery trial from the United Kingdom, which started reporting data late spring, early summer. And what they found, interestingly, was that patients that were being treated with steroids were doing much better. The particular steroid that they used was dexamethasone. Hospitals, therefore, all over the world started using steroids. And actually now, if we look at COVID hospitalized patients, they are actually doing better. And there's many doctors, including myself, who believe that this is largely due to the fact that we are treating them with steroids now. So, as for patients with prolonged loss of taste and smell, what we do know is that for other viral infections that report ongoing unusual symptoms such as Bell's palsy, we often prescribe a short course of steroids. And my question is whether a short course of steroids should also be prescribed in patients who have recovered from their other COVID symptoms but have got ongoing loss of taste and smell, which is very, very common. My advice is that if you have somebody in your life, whether it's a family member, a friend, or anyone else you know who has this specific symptom, to go to your doctor and request their opinion on prescribing a short course of steroids. I personally would do it myself. It's a relatively harmless, benign thing to do. A short, say 5 to 10 day course of prednisone or dexamethasone is generally very well tolerated, few side effects, but ask your doctor for their opinion because this may well become standard of care in the future. So there we are, today's talking point. Thank you very much for listening. Go ahead and find us online on our Facebook page, on Instagram, on Twitter, Common Sense COVID Doctor. We're all about presenting real frontline data, presenting facts, discussing many controversies that you won't see on the news. See you next time.